COVID-19 official statement number 2. The Pohnpei State COVID-19 Task Force advises that as of January 18, 2021, the crew and passenger of MS Chief Milo were tested for a second time with the same results. The same crew member who tested positive on January 7, 2021 was found to be positive on January 18, 2021. The test results have been submitted to the U.S. Centers for Disease Control (CDC) to verify if this case is a new infection or a recovered case with small amount of the virus still present in the bloodstream. 3 healthcare workers from Pohnpei State Department of Health and Social Services boarded the vessel in full personnel protective equipment, disinfecting the gangplank as they boarded MS Chief Milo and disinfecting themselves and their boat when they returned ashore. The Pohnpei State COVID-19 Task Force would like to reassure the public that the health workers followed all the appropriate infection control protection protocols. There was no risk of transmitting the virus when protocols were followed properly. The health staff were wearing full personal protective equipment gear, which was then safely removed and safely disposed of according to established protocols. The health staff have also received their first of 2 COVID-19 vaccination. Pohnpei State remains in COVID Condition 4. The decision to remain in Condition 4 is based on the medical assessment that there is a very low risk and potential of community transmission in Pohnpei as of today. The vessel MS Chief Milo is anchored several miles of Pohnpei's shore where 24-hour security is provided to ensure no one leaves or boards the vessel unless authorized by the Department of Public Safety. We will continue to work together with the community to address any prevailing concerns. For general information about COVID-19, contact 3203109, listen to daily updates on Physics Age Radio, visit the official Pohnpei State government website, pohnpeistate.gov.fm, or Facebook page, Pohnpei State Angangkela. Niwao o Kalangan, Pohnpei State COVID-19 Task Force.